We're now going to look at how child quality measures data will be reported by giving a brief overview of MACPRO and the state roles for quality measures. We previously discussed this in depth during the MACPRO state roles training, so if you attended that presentation, the next few slides will be a refresher for you. MACPRO is a web-based system for the submission, review, and management of Medicaid and CHIP initiatives such as the quality measurement reporting and state plan amendments. For some applications, MACPRO will be a new online submission tool. For others, it will be a change from what was a manual workflow to an electronic workflow. And for some, it will be the first time information is collected. In terms of quality measurement reporting, MACPRO replaces the CARTS reporting for quality measures, and MACPRO is also the system for reporting developmental measures as part of the Maternal and Infant Health Initiative, including under the Adult Medicaid Quality Improving Maternal and Infant Health Outcomes and Medicaid and CHIP grant. MACPRO is being implemented to improve the state reporting and federal review processes, program management, and transparency. Both CMS and states will know where a submission resides, when the CMS response is due, and the status of the review. Additionally, MACPRO supports data-driven decision-making in Medicaid and CHIP programs. A number of distinct roles have been established for states within MACPRO. These roles determine in what capacity a user will employ the system. It's important to note that the user roles in MACPRO differ from those that are used in CMS's other web-based systems, and in some applications, this is the first time that there are roles. This slide lists the 4 quality measure roles for state users. The state editor is responsible for building a quality measures report. The state point of contact, also known as the SPOC, is responsible for reviewing and editing a quality measure report. The state director conducts the final review of the quality measure report, certifies the report, and submits the report to CMS. And the state system administrator, also known as the state admin, is an administrative role that approves and modifies state user roles. We would like to note that in this initial release, the range of the state admin's activities may be limited, however, it will expand over time. A state user may have more than one role in MACPRO, with the exception of the state system administrator. With this release, individuals with the state system administrator role only can hold that role. It is important to note that all state roles must be filled for proper workflow functionality. And if you hold multiple roles, you will have one user ID, and all tasks and actions you are authorized will populate within your account. So let's begin by reviewing the state workflow for creating, reviewing, and submitting quality measure reports. Here is a brief overview of the state child core set quality measures reporting submission workflow. First, the state editor logs into MACPRO, enters the necessary information, and submits the report to the state point of contact for review. Then the state point of contact, or the SPOC, reviews the report. Assuming the SPOC is satisfied with the report and does not wish for the state editor to make detailed edits, the SPOC forwards the report to the state director to review. If the state director agrees with the information, they will certify and submit the report to CMS. If the state director would like changes to be made, they may return the report to the SPOC for further work by denying certification. Here is a more detailed workflow showing the steps to create, review, and submit a child core set quality measure report. We will walk through this process in the system, starting with the state editor, and we will return to this workflow to review the details. So now let's move into the MACPRO training environment to begin. Please note that because this is a training environment, you may notice slight cosmetic differences between this demonstration and what you see when you go into MACPRO to submit your quality measures. So now we're getting started by logging into MACPRO as the state editor. Again, we are working in the training environment today. The information that you see during this training is arbitrary information, only being used for training purposes. Your state should be sure to follow all technical specifications. Additionally, we are using the Commonwealth of Virginia, but this is not a reflection of Virginia or their quality measures information in any way. When you first log into MACPRO, you are taken to your news page. This page operates similarly to a social media platform. You can write a post for your team, send a message to an individual, send a task to an individual, or recognize someone by providing them kudos from the text box located at the top of the page. To begin Medicaid and CHIP Child Core Set Quality Measures reporting, first go to the Actions tab, and this is located on the toolbar at the top of the page. As you can see on the Actions page, this is where MacPro users have the opportunity to perform several actions, including creating an adult quality measure report, a health homes quality measure report, a maternal and infant health quality measure report, or a Medicaid and CHIP child quality measure report. The state editor also has the option to delete an annual report, generate a MacPro report, request a role, or view the implementation guides. There are two options for viewing the implementation guides. One selection will allow you to view all submission types, and the second selection, which is just below that, is for quality measures only. Now, because we are in the training environment, we have the ability to create reports within several authorities. This screen may vary when you log into MacPro depending on the authorities you indicated within the role request template. For the purpose of this demonstration, we will create a child quality measure report. The steps we will go through generally apply to all types of quality measure reports with a few minor exceptions. There are demonstrations that walk through how to create the other quality measure reports as part of MacPro training. These trainings are recorded for your future reference. So let's get started by selecting Create Medicaid and CHIP Child Quality Measure Report. This takes us to the Medicaid and CHIP Child Quality Measures Report admin page. There is a drop-down option at the top of the page to select the federal fiscal year you will be reporting on. As Megan noted, historical data from CARTs will be transported into MacPro in the future. The core set measures listed, there's also a drop-down to select an authority. Core set measures are listed in the Not Started status, and there is one additional measure in the Not Started status at the bottom of the page. At the very bottom of the page, you may provide information regarding delivery systems, external contractors, and you may upload a document. I do want to point out that this report documents section is meant to include supplementary documents to accompany your MacPro report. So we're first going to determine the fiscal year that we'll be reporting on, and for this training we're going to make sure 2015 is selected. So this is at the top of the page, and 2015 is already selected. Next, we're going to choose the authority for the report, and for this training we will make sure Medicaid only is selected. And now I'm going to pause to point out some links that may be helpful during this process that are located on the upper right side of this page. First is the Request Technical Assistance link. This link will allow you to submit a TA request to the Medicaid and CHIP Quality Measures Technical Support and Analytics Support Program. This link should be used for questions related to the report content, such as how to develop state rates based on data from multiple data sources, or questions about the measure technical specifications. Questions related to using the MacPro system should be directed towards the MacPro Help Desk. We will go over how to contact the MacPro Help Desk at the end of this demonstration. So let's select the Request Technical Assistance link. Indicate that yes, you have a technical assistance request for the current year. You may compose your question in the text boxes provided. It will be sent as if it is from your email box, which is the email included in your user profile. Please note these messages go to the Mac Quality TA inbox. You may CC your colleagues using the carbon copy line. For this demo, we will CC the MacPro Help Desk just as an example, and we're going to email them at macpro_helpdesk@cms.hhs.gov. If you wish, you may enter multiple email addresses into the CC field. You'll need to separate the email addresses using a comma like you would in Outlook or Gmail. Then in the subject line, we're going to enter Training TA Request. We're just putting this in as an example for training purposes, and you would treat this as a subject line to any email you would typically send. Then in the text box, we will enter a brief message indicating our content-related question. Note that there is a 4,000 character limit. And as you can see, we've used 35 out of 4,000 characters, and this is written in gray at the bottom left of the text box. The next section can be used to indicate whether or not you want technical assistance with reporting this measure in a future year. We will indicate that no, we do not want technical assistance with reporting this measure in a future year. And now that our TA request is filled out, let's submit our request by selecting Send Request in the bottom right-hand corner. You will receive an automatic response from the Medicaid and CHIP Quality Measures Technical Support and Analytics Support Program mailbox immediately following the submission of your request. And here's an example of what that will look like. The Quality Measures TA team will respond to your request in a timely manner. Again, as a reminder, only submit technical assistance questions through this avenue if they are related to measure content. All questions related to how to use the MacPro system should be directed towards the MacPro Help Desk, which we'll review at the end of this training. The second link that I like to point out at the top of the page is the View Implementation Guide link. By selecting this, you may download a PDF version of the implementation guide for your reference. The implementation guide is a document that provides specific information on how to complete and review a specific section of MacPro. You may also access the implementation guides from the Actions page, as I pointed out earlier in the training. Now let's begin by selecting core measures to report on. You may select multiple measures at once, so let's select follow-up care for children prescribed ADHD medication, also known as ADD, and ambulatory care emergency department ED visits, which is abbreviated as AMB. Scroll to the bottom of the page and select Begin Reporting. Fill out the information for the first measure. In this case, follow-up care for children prescribed ADHD medication. This page is dynamic, and more questions will appear as we go along, depending on our selections. So first select Yes, because we are reporting on this measure. The first section is Status of Data Reported, and you may select the small plus or minus sign to the right of the section to expand the field. Each section will require us to expand the field to provide an answer, and in order to avoid extra clicking, let's select View All Responses at the top of the page to expand all sections. Now that the status of data reported is expanded, we see that there is a question. What is the status of the data being reported? And we are going to answer Final. The next section is Measurement Specification. This section is asking us to specify if the measurement is NCQA or HEDIS or Other. For this training, we will choose the first option, or NCQA/HEDIS. Then we're going to select 2014 as the version of HEDIS used. As we saw here, and as I mentioned a few minutes ago, the pages in MacPro are dynamic, and more questions will appear as we go along depending on our selections. Next is the Data Source section. Let's check off Administrative Data. This prompts the system to ask us some more questions. And we're going to indicate that the administrative data are coming from MMIS, or the Medicaid Management Information System. Please note that you can select more than one checkbox. And now that our selection has been made for data source, we're going to move on to the date range section. All measures reported need to have start and end dates for the measurement period. As the directions indicate and as Mathematica explained, the measurement period entered should not include the look-back period, as applicable. For this training, we will use July 2014 as the start date, and July 2015 as the end date. Again, this is arbitrary information that we're using for training purposes. If at some point while you are filling out your report, you want to return to the admin screen, you can do so by going to the bottom of the current page and selecting Save. You must make sure that you select this so that all of your information is saved. The system does not automatically save your entries at this time. Also, please note that clicking Save will take you to the top of the page and minimize all of your open sections. However, as you see, by expanding some of these fields, our entries are still in place. And we can now return to the 2015 Medicaid and CHIP Child Core Measure admin screen by selecting Go to Admin Screen at the bottom of the page. As you see here, you can look at the other core measures available. Additionally, the ADD measure is currently listed as in progress because we began filling in the required information. You will notice that some measures are marked as complete even though we have not worked on them. If we scroll down, we see there's one right there. For some measures, CMS does not require the state to report information. These measures are automatically marked as complete, but states may choose to include information for the measures. When you would like to return to the ADD and AMB measures, you can do so by checking the boxes and selecting Begin Reporting again at the bottom of the page. This returns us to the ADD measure we were previously working on. So let's continue by first selecting View All Responses at the top of the page. This minimizes the clicking we would do to expand each field. We're trying to stay efficient with our time. Then we can return to where we left off at the definition of population included in the measure. First, we'll define the denominator. So let's select Denominator Includes CHIP Title 21 Population Only. As you can see, if the denominator is a subset of the definition selected, we must further define the denominator and indicate the number of children excluded. For this training, we're just going to enter some dummy information into this field for just a training example. Next, we're going to indicate that yes, the denominator does represent your total measure eligible population as defined by the technical specifications for this measure. Then we will select the delivery systems represented in the denominator. As you'll read in the instructions in gray, you must select at least one delivery system that applies to your state. For each delivery system selected, enter the percentage of the measure eligible population represented by that service delivery system. And again, this is something that Mathematica went into in detail in their presentation, so if you have questions, you can feel free to refer back to their slides. And for this training, we will select fee for service, and then we're going to include 100%. Again, as a reminder, any selections that use checkboxes allows you to indicate more than one option. And you can remember to use this as a reference for how you may enter your information throughout the report. Next is the performance measure section. This section includes text boxes. Make note that there is a 2,000 character limit. The character count is tracked for you in gray at the bottom of the box. And for this training, we're going to check off the initiation phase. We're then going to include a numerator, denominator, and rate. For the numerator, we will enter 1,000. The denominator will be 2,000. And you'll notice as soon as we click out of the text boxes, our rate auto-calculates. This is because we selected administrative data only, and when administrative data only is selected, your rates will auto-calculate. If you do not select continuation and maintenance, the C&M phase, the corresponding text box explaining why the data was not entered is a required field. This is indicated by the red asterisk located at the end of the text describing the text field. And all required fields throughout the report have a red asterisk. Again, similar to the checkboxes I was referring to you about, please use this red asterisk as a guide for how you could complete the report. And since we're not checking off the box, we're going to include some dummy text, just explaining why we were not entering this numerator, denominator, and rate set. This is for training purposes. You can see that we've used 35 out of 2,000 characters in gray at the bottom of the box. Now let's continue to the deviations from measurement specifications section. There's only one question. Did your calculation of the measure deviate from the measure specification in any way? We will first indicate yes. As you can see, this prompts you to enter more information, and we're going to go back and enter no. Again, I'd like to remind everyone that MacPro includes dynamic fields, and as we saw here, your selections determine which questions become available. Next, we're going to complete the combined rates for multiple reporting units. And we're going to indicate that we did not combine rates for multiple reporting units. The next two sections are optional. Note there is not a red asterisk in these areas. The first section is your opportunity to provide CMS additional notes. This is an optional field and is indicated as such. Please use this space to provide further explanations of any aspects of your state's reporting for the measure. This information may include context about why a data field cannot be reported by the state, a change in the state's methodology, population, or program that would affect trendability of the measure, or definition of the reporting units, such as health plans or programs, included in the state level rate. We're going to skip this section for today's training. The next section is the optional measure stratification, as the title suggests. It is also an optional field. And let's include optional measure stratification for geography. We have the option of selecting urban, rural, or adding additional geographical regions, and we're going to select rural. Automatically, we are able to report on 2 phases. So we're going to enter some information for the initiation and C&M phases. Our numerators will both be 100. Our denominators will be 1,000. And our rate will auto-calculate, and that is because we indicated administrative data only. We're going to put the same information in for the C&M phase. And then you'll notice on the bottom right-hand side, there's the option to add an additional or alternative classification or subcategory. We're going to select that blue link to add an additional alternative classification or subcategory. And our alternative classification will be the future phase. Our numerator is 100. Our denominator is 1,000. And again, our rate auto-populates once we click out of the text field. And next, we're going to add an additional geographical region. You can do so by selecting the additional geographical region link, which is under the table, more on the left-hand side. And we're going to add a location as suburban. Then we're going to report on the initiation and C&M phases. Our numerators are going to be 1,000, and our denominators will be 10,000, just to mix it up a little bit here. Our rates will auto-calculate. And again, if you're wondering if your rate's not auto-calculating, try clicking out of the text box and that will prompt the auto-calculation. I want to remind everyone that we are using arbitrary numbers for training today, and you should be sure to follow all technical specifications when completing your state's report. Although we are in the state of Virginia in this training environment, this is not a reflection of Virginia in any way. So at the bottom of the page, if you have any reports to upload, you may upload them. You may also upload documents to the report from the admin screen. We will be uploading documents to the report from the admin screen later in this training, but you do have the option to upload documents from each measure page. Documents uploaded should be supplementary to the information included in MacPro. The final question within the course set is if we'd like to validate our answers. The measure does not need to be validated at this time to proceed, but it must be validated for the measure to be marked as complete. All course set measures must be complete to submit the report to CMS. So for this training, we're going to select yes. And you'll see that there's a note below that says if validation fails, errors will appear in red above. Validation ensures that information is fully filled out within the report. If there is a field that is missing the required information, the system will indicate what information is required in red prior to allowing you to complete the course set measure. If at this time you are not ready to complete the report, you have the option not to validate the measure. This core measure will be noted as in progress on the admin page until you validate the report and it is completely filled out. So let's now move on to the next measure by clicking Go to Next Measure at the bottom right-hand corner. Since there were no error messages, we were able to continue to the Ambulatory Care Emergency Department Visits measure. We're not reporting on this measure, so we're going to enter no. Next, there are a series of checkboxes presented to explain why we are not reporting on this measure. We must select at least one, but we may select all that apply, so we're going to select Service Not Covered and Data Not Available. We must explain why the data are not available. We're going to indicate that the information was not collected and that it was not collected by the provider. If you have any report documents to upload, you may do so below. And like I explained a few minutes ago, you may also upload documents to the report from the admin screen. Next, indicate that yes, we would like to validate the core measure data at this time. And then we're going to select Go to Admin Screen. The status of the ADD and AMB core measures are now complete. In order to submit the 2015 report to the State Point of Contact, or SPOC, the state editor must complete the information for each core set measure, like we did for the ADD and AMB measures, either indicating that your state is reporting on the measure with all accompanying information, or that your state is not reporting on the measure and why. In order to be efficient with our time during this demonstration, we created a Medicaid and CHIP child core measure set report with all core set measures completed earlier today for us to submit to the SPOC for review. To access reports that you're in the process of working on, you can do so by going to the Records tab at the upper toolbar. Select Medicaid and CHIP child quality measures. And then we will choose the report we created earlier today. You'll notice that there's a report that we created a moment ago, and that report ends in 1003. But we're going to select the report with the package ID Virginia 2015 MCQM_1001. This package ID consists of the state or territory abbreviation for the report, the year, the type of report, in this case MCQM, which stands for Child Quality Measures for Medicaid Only, and a MacPro generated number. There are several packages included here, and that's because we have several reports that were created throughout the training development process. So when you log into MacPro, you're not going to have this many reports listed. So select the link to the report, and this takes you to the report summary page with a timeline indicating the stage in the process the report is in. It includes report information, SPOC information, which again stands for State Point of Contact, and audit information. You'll notice on the left side of the page, you also have the option to view news related to this report, related actions, report data, and a consolidated view. If there are multiple versions of the report, you could view older versions of the report here as well. To continue modifying this report, select the Modified SHPRA Quality Measures button in the top right-hand corner. As you can see, this takes us to a report for 2015 with all core measures in the complete status. The status says complete, and there is a green checkbox in a circle. Again, this is not a reflection of Virginia or their quality measures information. This is just arbitrary information being used in the training environment for training purposes. When your state completes your report, please be sure to follow all technical specifications. So next we have the option to complete the delivery system section by indicating the percentage of enrollees that were in each delivery system. For this training, we're going to assume all enrollees were in the fee-for-service delivery system by indicating 100%. For both Medicaid under age 21 and CHIP. Next, select whether your state obtained assistance from one or more external contractors, and we're going to indicate none of the above. You may update this portion of the report prior to sending the report to the State Point of Contact, or SPOC, for review, or throughout your process of completing the core measures. As a note, be sure to select Begin Reporting or Request State POC Review, whichever is appropriate for your situation, after completing this information to ensure that it is saved. Next, you may upload accompanying report documents. You can upload a maximum of 84 documents to a report, and the maximum file size is 2 megabytes. You may upload PDFs, PowerPoints, Word documents, and/or Excel spreadsheets. We're going to upload 2 PDF documents for this training. First, we're going to select Browse. Then we're going to go select our test documents. These are just blank PDFs that we're using for training purposes, just to show you the process of uploading a report. You have to put a description next to any document you upload. This will show up in the table, so that way if you have several documents included, You can have a hint as to what they are beyond what's in the title. Once you have the description, hit Save Documents. And if the save process is taking some time, or if we see that it's in progress, you can click the refresh button, and this will take you back to the admin screen. And if you have trouble on that page, you can always reach out to the MacPro Help Desk for assistance. We're going to browse and add a second test document just so we can show you some different sorting options within the table. We're going to add another description in quickly here. And then we're going to save the document. Again, you can hit the refresh button on the Save in Progress page. This helps kind of expedite your process, but if you get hung up here, you can always reach out to the MacPro Help Desk for assistance. And sometimes you're moving a little bit faster than the save process is. So now you are able to sort documents that were uploaded by clicking on a column header. A red arrow will appear to indicate the column header that the documents are being sorted by, as well as whether they are being sorted in ascending or descending order. As a quick note, you may upload documents from a core set measure screen as well as from this administrative screen, which is centrally located at the bottom of this page. All uploaded documents are uploaded to the report in general and are not specifically uploaded to core set pages. I also want to remind you that these documents are meant to be supplementary to the information that you're including in MacPro. Now, if at some point you want to delete a file, you may check the box next to the file and select Delete Document. We're not going to delete a document in this training, but we wanted to show you the different options that you do have available to you. At this point, we are ready to request the State POC review, and we're going to select Request State POC review at the bottom right of the page. This takes us to the Records Report Summary dashboard for this report. And as you can see on the timeline, the report is now in review. Additionally, there is no longer an option to modify your report in the upper right corner, like there was earlier in the training. You will not be able to edit this report as a state editor again unless the state point of contact returns the report to you. So now let's return to the PowerPoint to review what we have done thus far and what the next steps are. So this is that workflow page that I told you we'd come back to. And if we're going to review the steps we just covered, focusing on the first row, which is the state editor row. We logged in into MacPro as the state editor. We selected the Actions tab along the top bar, then clicked the Create option for Child Core Set Quality Measure Reporting. Next, we selected the fiscal year of interest, the core measures we would report on, and we began filling out the needed information. When we finished entering the information, we chose to validate our information. Then to expedite the training, we moved to a completed report rather than selecting additional measures. When everything was finished, we selected Request SPOC Review to complete the process. So I know I did just go over a lot of information as the state editor, and before we jump back into the training environment, I want to open up the line for question and answers just for a few minutes to see if we can answer any questions at this point.
All right, ladies and gentlemen, once again, if you have a question, please press *1 and immediately record your name, your first and last name, followed by the # key.